Hello everyone. Today we'll discuss about the anterior triangle of neck, and in that particularly about the submental triangle and the digastric triangle. Now this is the anterior triangle of neck. In that we have further four subdivision of the anterior triangle, that is the submental, submandibular, carotid and the muscular triangle. Remember that this submental triangle is only one, okay, and rest all are in pairs, means over here submandibular, over here submandibular, carotid, carotid, muscular, muscular, but only this submental is one. Now the boundaries of the anterior triangle of neck. First of all, as you can see in this triangle, medially, as you can see, medially the anterior median plane of neck. This is the anterior median plane of neck medially. Then sternocleidomastoid muscle laterally, the inner border, medial border of sternocleidomastoid muscle laterally. And the base of mandible, this is the base of mandible, and the line joining the angle of the mandible and the styloid process. Okay, so base of mandible and the line joining the angle of mandible and the mastoid process of temporal bone superiorly, because this triangle is actually inverted. Now subdivision I told you before only, submental, submandibular, carotid and the muscular triangle. Now submental triangle particularly, as you can see this over here, this is the submental triangle. I told you before only submental triangle is only one. So this is the half view. This pink color is the half structure of the submental triangle. This whole is the one submental triangle. Now this is a median triangle and is actually bounded by, remember, on each side. On each side, as you can see, this is the anterior belly of digastric muscle. Okay, so on each side, anterior belly of digastric muscle. Okay, on each side. Okay, and remember at the apex, it lies the chin. And the floor of the triangle is mainly formed by the right and left mylohyoid muscle and the median raphe which unites them. Okay, so mylohyoid muscles and the median raphe. So remember, digastric muscle on the sides, apex, chin, and the floor is formed by the mylohyoid muscle and the median raphe. Now mainly the contents. Now for the contents, just remember that 2 to 4 small submental lymph nodes. As you can see, this is the triangle, submental triangle. So over here 2 to 4 small submental lymph nodes are actually situated in the superficial fascia between the anterior belly of digastric muscle. This is the anterior belly. So between these two we have submental lymph nodes. And remember, this submental lymph nodes actually drains mainly 5 places. That is the superficial tissue below the chin, because it is over here the apex is at the chin. So superficial tissue below the chin, central part of the lower lip, the adjoining gums, anterior part of the floor of the mouth and the tip of the tongue. These 5 things actually drained by submental lymph nodes. And the efferent from this lymph node actually passes to the submandibular nodes. And over here, as you can see, small submental veins are also present. So this small submental vein will actually unite together and will form the anterior jugular vein of submental triangle. And this anterior jugular vein will go downwards, will descend downward and will unite and form this jugular venous arch. So 2 things, the submental lymph node which will drain particular 5 places, and this small submental veins which actually unite to form the anterior jugular vein. Now the digastric triangle. Digastric triangle is this one. This is a digastric triangle which is actually in pair over here and over here also. Submental triangle is only one, while this digastric triangle is 2 in number on each side. Now very important, the boundaries. The boundaries of the digastric muscle are over here, as you can see, antero-inferiorly, postero-inferiorly and the superior or the base. Now antero-inferiorly, as you can see over here, anterior belly of digastric. Postero-inferiorly, as you can see, posterior belly of digastric. This is the posterior belly of digastric. Over here, as you can see, the tendon or the pulley of this digastric actually attached at the hyoid bone. So this is the anterior belly which forms the antero-inferior, posterior belly forms the postero-inferior, and the superior or the base, as you can see, is formed by the base of mandible and the line that joins the angle of the mandible with the mastoid process of a temporal bone. Now the roof. Now the roof of this triangle is mainly formed by, remember, skin, superficial fascia. Now in this superficial fascia we have platysma muscle, cervical branch of facial nerve, and the ascending branch of transverse or cutaneous anterior cutaneous nerve of the neck. So remember 3 things in the superficial fascia: platysma muscle, muscle of the neck, platysma muscle, then cervical branch of facial nerve, and the ascending branch of transverse or the anterior cutaneous nerve of neck. And remember, deep fascia is also present in the roof of this, and the deep fascia actually splits to enclose the submandibular salivary gland. If you know, submandibular salivary gland is actually present over here in this region. Okay, so in the contents also we can consider the submandibular salivary gland. Okay, so over here the submandibular salivary gland is actually splitted by the deep fascia at the roof of this triangle. So now the floor is actually formed by the, of course, mylohyoid muscle. These are the mylohyoid muscle fully. The mylohyoid muscle anteriorly and by the hyoglossus muscle posteriorly. Anteriorly mylohyoid muscle and posteriorly hyoglossus muscle. Now small part of middle constrictor muscle of the pharynx is also present or appears in the floor. So three things: mylohyoid, posteriorly hyoglossus, and also part of middle constrictor muscle of pharynx. Now mainly very important, the contents. Now for the contents, we divide the triangle into two parts: anterior part of triangle and the posterior part of triangle. Now the contents of the anterior part of triangle. Now as you can see in this triangle, we are having first of all the superficial part of the submandibular salivary gland, then the facial artery and vein. The facial artery is mainly present deep to this triangle, while this facial vein and the submandibular lymph node actually present superficial to this triangle. Then the hypoglossal nerve, then the nerve to mylohyoid muscle, submental artery, and some of the vessels of the mylohyoid muscle. Now the posterior part of triangle, in that we will divide it into mainly three regions, that is superficial, deep, and deepest. So now in the posterior part of triangle, in the superficial part, we will be having the lower part of parotid gland and the external carotid artery before it pierces the gland. Okay, or pierces or enters the gland. Okay. Now deep we are having first of all the styloglossus muscle, stylopharyngeus muscle, and the styloid process. Remember, these two muscles are very attached to the styloid process only. The styloglossus and the stylopharyngeus, and the styloid process itself. The glossopharyngeal nerve and the pharyngeal branch of vagus nerve. And in the deepest part, we will be having the internal carotid artery, internal jugular vein, and the vagus nerve. So this was all about the main two triangles, that is the digastric triangle and the submental triangle of the anterior triangle of neck. We will discuss about the further triangles of the neck in the further next videos. So hope you are well. Thank you so much.